So here today we have with us Becky Sultana, our social prescriber. Welcome to the practice.
Thank you.
Could you sum up your role in one sentence for us?
Sure. My role as a social prescriber is all about connecting and supporting people with non-medical support, which aims to improve their health and well-being and tackle social isolation and loneliness.
That sounds great. And so who are your target patients?
We can support anyone over the age of 13 that is happy to engage with social prescribing and feels that they would benefit from this service. So this includes anyone with anxiety, low mood, people with long-term conditions, if a person's out of work, unemployed, someone who may have recently bereaved, carers and ex-carers, the list goes on. So it's anyone who's socially isolated, wants to find out a bit more around the support and services available to them. So anyone really.
That's great. And so what can a patient expect from a consultation with you?
During the appointment, the patient and I will work together to make decisions based on what's important to them. We will give them time and focus on what matters to you and take a holistic approach to person's health and well-being. We will explore and identify the opportunities, support and services that they could benefit from. The session also aims to provide awareness and information support. We're here not to tell them what to do, but help guide them to make the decisions and the goals and the things that are important to them.
And so how can patients get to see you?
Patients are welcome to contact the surgery directly, so they can ring reception, book an appointment, and that sort of thing. If they've already got an existing appointment with a doctor, nurse, any other health professional, it may be offered. So it's up to them if they wish to engage. Often doctors, nurses and other members of staff will often task me directly to contact a patient they feel would benefit from social prescribing.
And so could you tell us about one of your success stories?
Sure, yeah. So during the COVID-19 pandemic, a lot of face-to-face support has been on hold due to the risks involved in that. Throughout the pandemic, I've been in contact with lots of patients who were struggling with the social isolation, accessing support, and anything that they felt they needed help with. So it's about listening and finding out what they needed and giving them suggestions and that sort of thing. I've been able to work with local churches and voluntary support services in the community to develop support for those that need it. We have supported over 300 patients in different ways, such as providing befriending wellbeing calls, helping them with transport to appointments, and prescription and food provision and that sort of thing. So yeah.
Oh, that sounds great. And so where do you see this service going in the next few years?
As well as seeing patients directly in the surgery or at the moment telephone calls, we hope to continue working closely with the community, external organisations such as charities and a local authority and the council in order to collaborate and deliver social prescription in a novel way that will really reach out to those who would benefit. This will hopefully include things like virtual and online group face-to-face consultations, workshops, group work, that sort of thing. We're also on social media, so Twitter, Facebook and Instagram, and try to interact with people that way. So that's a method of support to patients as well. We're also planning to work with local schools to support students and younger people, and hopefully that will be another form of support for the schools as well.
That's great. And so what do you find most exciting about your job?
That's a good question. The diversity of the role, I would say, the opportunity to be innovative, to support patients getting connected and learning about how much support is out there. It's great being able to bring together the whole range of opportunities available now. As we know, it can be difficult to find the information out yourself. It can be a simple solution that someone has not thought or heard about. Being able to get people with support, whether it's practical or emotional support, is really important to a person's health and well-being.
Amazing. So what exciting things are coming up on the horizon for patients to get involved with?
During the last couple of months, I've been working with the local arts services based around music to deliver social and mental health support group. Other plans include working with local organisations to continue providing support with practical tasks, so shopping, medication, befriending and transport across the whole area. Another idea is about, like I said earlier, about delivering group consultations based around themes that are important to patients. So it could be around anxiety management, awareness of support, but it's around what a person, patient wants rather than us telling them really. So lots of different things are happening in the next few months.
That's great. So lots of exciting things coming up. Thank you very much for coming to see us.
Thank you.
Great to learn a little bit more.